Welcome, welcome. Happy 420. Happy Friday. Hope everyone is enjoying themselves. I hope everyone is in a good spirit. And I hope everyone is here to learn, listen, and have some fun. I am Juma, and this is LEAFSTYLE, where education, community, culture, and cannabis collides. Welcome, welcome. Today we have an incredible show. I'm really excited about this one. We have some of the leading doctors and scientists in their space to really come and give their perspective, provide us some insight and some education. So we're really excited, and we want to do a warm welcome for our 5 distinguished doctors here. We have Dr. Michele Weiner. You can give a little wave. Dr. Michele Ross, Dr. Safiya Lyn, Dr. Rachel Knox, and Dr. Claudia William. As we wrap up 2020, we're ending this year. Like I said, I think generally it has to be a general consensus that 2020 has been a crazy year. And one of the things with COVID is clearly highlighted sort of health issues in our country, generally speaking, and the health disparities have been highlighted. So we're all focused on health. Health has been at the forefront, as it should always, but also ways in which we can actually just be healthier people, prevention, and an overall healthier lifestyle. And one of those ways is incorporating cannabis. If it meets your needs, how can you incorporate cannabis in this whole sort of healthy lifestyle? So again, we thought it'd be great to hear from the doctors themselves. We all have hopefully been to a doctor and consult with doctors for our health needs. And so it's important that they are also part of this cannabis community, and not only a part of it, but leading on the forefront and leading the discussion. So that being said, please, first starting with Dr. Michele Weiner, please introduce yourself and tell us a little bit about yourself.
Thank you for having me. I'm happy to go first. So my name is Michele Weiner. I'm an integrative pain management physician in South Florida. As we were speaking about earlier, I have a few offices from Boca to Miami. And I got into cannabis medicine about 4 years ago when I was very frustrated with the tools that I had to treat my pain patients. And I take a more holistic approach. I'm a DO. I have my master's in public health, and also involved in some research looking at delivery methods like nano-emulsions, as well as using cannabis as a substitute for opioids. We just got a grant from the state for $75,000 looking at seniors who are taking medical marijuana for pain management. So I'm a big cannabis advocate, and now I started incorporating ketamine in my practice as well, which has really, become a catalyst for change and more into personalized medicine and trying to move, everybody forward to really look at harm reduction, but with the evidence. So thank you for having me, and I look forward to today's event.
Thank you. Dr. Michele Ross, please introduce yourself.
Hey there. Again, thank you for having me. I'm a neuroscientist with fibromyalgia turned cannabis coach. I'm a medical advisor to Berryhill, which is a medical marijuana card company. So I talk to patients all over the country about how to use cannabis properly. And I've created a lot of different educational courses, including the first certification course on cannabis and motherhood, which of course is a very controversial topic. I created books like Vitamin Weed, a 4-step plan to prevent and reverse endocannabinoid deficiency. And I have a new book called CBD Oil for Health that's coming out in 2 weeks, which I'm really excited about. And, I've really done the whole spectrum from being a scientist who studied cannabis to being a patient who needed it, to being a clinician that helps other people use it. So I have a very unique background that really helps me connect with a lot of different groups, including legislators, to really help, pass some of the drug reforms that we really need. So I've been very excited to work in cannabis, but I'm also very passionate about psychedelics and some of the other different medicines out there that can help patients. I really do believe in, a freedom of choice when it comes to healing yourself.
Great, great. Appreciate that. And Dr. Michele Ross is a neuroscientist, so she's the only non-medical doctor here, correct?
Yes, but I do see patients in a more educational and harm reduction sense.
Great, great. I appreciate that. Dr. Safiya Lyn, please introduce yourself.
Pleasure to connect again. We had a great call, you and I, a couple weeks ago, so I'm happy to be back with you and also share this platform with all these amazing physicians and scientists and women of color. So happy to be here speaking on behalf of everybody. My name is Dr. Safiya Lyn. I'm an emergency medicine physician, graduated from Meharry Medical College and did residency in Morristown, New Jersey, and then found my way down here in Miami and never looked back. I've been here for about 8 years now. And I got into the cannabis space as well about 4 years ago in 2016 when we became legalized for medicinal use in South Florida. So my main focus is patient education and patient access. My frustration stemmed from working in the emergency department and seeing so many people with overdose cases and people that we couldn't recover from opiate abuse and benzo abuse. And I just kind of got frustrated with the narcotics scene. So one of my main goals was to be able to offer an alternative and educate myself so that way I can inform patients properly about the benefits of cannabis use and CBD and THC and hemp and all of that, because a lot of that language is very new to a lot of people. So just teaching them vocabulary, not to get overwhelmed, and taking it step by step with transitioning from chronic use with opiates to integrating cannabis to eventually weaning them off of opiate and narcotic use. So that's one of my specializations, but my main goal is just patient education and access. On my website, askdrlyn.com, I do a lot of interactive medicine with everybody, and I'm mainly on Instagram at askdrlyn as well, where I answer all your DMs and questions about anything that you have regarding the topic. So again, my marriage between emergency medicine and also cannabis has been beautiful because I've been able to see patients directly and offer them immediate access and treatment. So it's been awesome.
Great, great. Thank you. Thank you. Dr. Rachel Knox, please introduce yourself.
Hi, everyone. Dr. Rachel Knox. Gosh, well, I'm one of 4 physicians in my family who have pivoted from conventional medicine to this space, and I was not the first. My mom was actually the first, so it's really hilarious. And people were like, what do your parents think about what you do? Well, my physician parents entered into this cannabis space while my sister and I were in residency, actually. So I have a background in family and integrative medicine, and I intentionally sought out at the time one of the few residency programs in family medicine that had the integrative component, because even as a medical student, I recognized that the medical establishment or big medicine was not equipping me with the tools to really help people heal. And that was wholly frustrating to me. And even throughout, residency, I recognized the tools at my disposal were not good enough. And I had the good fortune of having 2 parents who came from anesthesiology and emergency medicine, respectively, to talk to about patients' use of cannabis as medicine, and to hear from them firsthand the remarkable stories of patients who turned to cannabis, whether that was literally reversing a disease state or helping patients get off prescription drugs, or just improving quality of life. That seemed like something I could get behind. And so I actually moved back home to Oregon and started my career in what's now endocannabinology and cannabinoid medicine. I'm also a board member of Minority Cannabis Business Association, Doctors for Cannabis Regulation. I've chaired the Oregon Cannabis Commission for the past 2 years, and I'm entering into my 3rd year as chair. And I serve the city of Portland on our cannabis policy oversight team. I am passionate about us all recognizing that cannabis prohibition and legalization is a health equity issue. We're not just talking about social equity. We want total equity. And the truth is that the whole plant has utility from root to flower, from hemp to marijuana. And we really should be looking at cannabis as a solution to the minority health disparity gap for one, but also for all people as a solution to really driving down our rates of morbidity and mortality. Our leading causes of death in this country are preventable and reversible. And we can use natural solutions to reverse those very conditions that are plaguing us and that are disproportionately, impacting us in this age of COVID right now. So I'm all about health equity and more specifically cannabis health equity these days.
Thank you. Appreciate that. Dr. Claudia William, please introduce yourself.
I'm Dr. William. I'm a plant-based physician. I'm board certified in family medicine and lifestyle medicine. I actually completed my training at the University of Illinois. Some people may know this fact, but that's actually where Roger Adams, the chemist, isolated CBD and CBN. That was almost more than 70 years ago. So CBD just recently became popular, so that's pretty funny. And I have my own practice in West Palm Beach. I see patients of all ages, and I see them for preventative medicine issues, acute issues, chronic issues. I recently started an organization, Hemp and Herb MD, that works to educate and advocate for patients that often we hear this false dichotomy, since I'm in the wellness space, that it's either medicine or natural substances, science versus nature, but that's just doesn't make sense. We should be utilizing everything that has evidence to improve quality of life. And quality of life is often overlooked. We look at factors like death and mortality, but as many of the speakers have already mentioned, prevention is as important as treating symptom relief, and the regular methods that we use aren't available. So my focus is reducing harm and reducing the stigma around using cannabis, making sure that patients feel like there is an actual doctor that they can speak to and not be judged. Patients often say, there's not a doctor I feel comfortable around. So I love being on this panel full of women that recognize the importance of being open and receptive. Women are underrepresented in medicine, cannabis, and patients often are ignored when they're women. So I think that we definitely can change that going forward. And I look forward to hearing what everyone has to say.
Thank you so much. So something you touched on there, Dr. William, is stigma, right? Stigma in all facets, whether it's the consumer, whether it's the physician, whether it's the doctor, the scientist. Can you guys talk a little bit about your journey into this space and sort of education-wise, colleagues, any stigma there, and just sort of overall your journey into this space and why cannabis has even become part of your practice? Dr. Lynn, would you like to start?
Gladly. My journey of into this wellness space and cannabis space has been met with a lot of opposition, mainly from colleagues, mainly from audiences who don't understand the purpose and the benefits of cannabis, even from peers who also practice as well. A lot of that came from their fear of lack of education and being ill-equipped to speak to their patients regarding the substance, right? So when you don't know something, you fight against it. I don't work independently for myself primarily. I'm an ER physician, meaning I am a third-party employee to a hospital, right? So anytime you work for an overarching company, they have a lot of policy and restriction. So one of the things that was important is that I always kept my two entities separate between emergency medicine and my medical marijuana business, because they were not impressed with the fact that I was prescribing outside of the emergency room medical marijuana. They didn't believe in it. They didn't trust it. They didn't know enough about it. This was 2016 when it was very fresh on the Florida scene. circle back 2 years later, they're asking me to do CBD presentations and lectures to our patients and our audience and our staff, because there's so many overwhelming questions coming from the patient population regarding its purpose, regarding access to it. How does it heal? How does it really work? How can we integrate it with our medications that we currently use? You know, so all of that that was initially met with opposition comes full circle when they understand a couple years in, this is not going any way. This is not going to be dissolved. It's not a fad. It's, you know, it's not apple cider vinegar. It's not keto diet. This is something that's here. It's becoming more and more prevalent, and its purpose and availability are becoming more and more over the last, especially, 4 years. So when it's coming on the TV nonstop, when it's, being asked by your patients, when you're ill-equipped and your residents don't know enough about it and your senior physicians don't know enough about it, they turn to me to ask to develop a series to be able to educate not only our physicians, but also our nurses, our ancillary staff. So everyone needs to be aware of the language and the questions that they're asking. And if they don't have the answers, be able to refer them to the proper education sites and people to talk to. So it's really awesome to be able to sit here now, full circle 4 years later, and understand that what I started to do that was met with so much, opposition and just defiance, that it's nice to be in a space where you're wanted and you're appreciated for your knowledge, and the time and education that I spent to teach myself about this industry and product is now being able to be appreciated amongst my peers, and I can also offer that to them as well. So it's been good. It's been good. It's been a learning process.
Great, great. Dr. Ross, as a neuroscientist, talk to us a little bit about that space and sort of any stigma, colleagues, judgy eyes, any of that you may have received on this journey.
Oh goodness, I would say that my journey with cannabis has been one of joy, but also tremendous hardship. So I was, one of the first to really be publishing and really be actively talking about using cannabis medicine. I started my PhD actually as a drug addiction scientist. So I was trying to find the cure for drug addiction. I grew up in front of a crack house in New Jersey, so I was very passionate about helping people. I didn't know anyone that smoked weed, that wasn't part of my life. And if I did, I probably would have told them to go get help, at that point. But I ended up getting signed a paper to look at how new brain cells can grow under the influence of cannabinoids. And that was my very first paper, made me open my eyes to maybe cannabis might be helpful. Maybe it might be good. And I started researching myself about cannabis because it wasn't taught in school. It wasn't taught even in our neuroscience program. We were taught about all these other different drugs and these different systems, but the endocannabinoid system was literally like 2 pages on that, and let's skip over that, even though it's such a critical part of our brain and our body. And it's so important to how we keep our body in balance. And yet we just skipped over it. And it was sort of insane to me. So I ended up, going into cannabis after a couple of different things that had happened. So first off, I had a whole bunch of different health issues that had happened that led me to cannabis. I knew cannabis could be helpful, but I didn't know personally that I should use it. I really did still feel that stigma, like, oh, it only should be for, dying cancer patients or somebody really, really ill, not just me, not somebody with, physical pain, nerve issues, things like that. Like, there's got to be a different way for this. No one will ever take me seriously if I'm smoking weed and trying to be a professor, things like that. I ended up marrying into the cannabis industry. So I ended up sort of having to do it anyways and sort of go full feet first into the industry and into consuming cannabis. But it caused a lot of problems in my life. One, other neuroscientists and other scientists that I'd worked with, especially those in the drug addiction field, thought I was a drug dealer, that I was harming people, that I was irresponsible, that they were ashamed of me. Even my mentor, who was so proud of me, I was like literally the first person in my graduate class. I finished my PhD in 4.5 years, which is unheard of. Like, I was the top of my class, and here I was having all my other colleagues tell me like they were embarrassed of me. So that was really just sad. And it took quite a couple of years to actually convince them after, research and the work that I did. And then also all the media coverage around cannabis, that actually cannabis is helpful for people. But there was a lot of years where it was really dark. It was really hard to get work. When I showed up for, say, professor jobs when I moved to Colorado, I was told, hey, you have to stop using cannabis. We know you're a cannabis user. You can't be teaching kids and be smoking marijuana, which of course I don't even really consume marijuana in that way. I use tinctures and other things. And obviously I'm not, we all know this obviously as cannabis clinicians, that you can be a functioning professional and, be a cannabis consumer, but that's not what the academic and professional world thinks. And so there was a lot of stigma. So I realized I couldn't really work within the normal confines of, okay, be a professor, be a scientist. So I sort of had to invent my own, world, create my own table. And so I created my own nonprofit, the Endocannabinoid Deficiency Foundation, and I started writing the first articles about cannabis for different diseases, including lupus and Lyme's disease and fibromyalgia. It sounds crazy, but this stuff didn't exist years ago. And so, I started doing a lot of work. And then because I was also sort of in the public eye, I had been the first scientist to star in reality television on Big Brother years ago. So I had created my nonprofit, and literally within 3 months of creating that nonprofit, I got raided by the Los Angeles Police Department and fought a case for distributing marijuana when I don't sell cannabis at all. I just do education to patients and doctors. So I fought a fake case, which was bizarre, but I lost everything during that time. So I've had this thing where I know cannabis works. It literally has saved my life. It's worked for so many patients. And yet every step of the way, I had this friction, whether it was government friction, whether it was stigma from the industry, whether it was just so many different challenges. And I'm so happy right now that there's been so much less hardship for people entering the industry. But it was really I didn't even want to share my story at the time, because a lot of clinicians and scientists were like, this is what you get for working with illegal drugs. I was almost like the cautionary story. And that's not what I wanted it to be. I wanted to say it's the laws that are unfair. It's the policies at universities that are fair. What I'm doing is the right thing, because I'm literally saving people's lives, people that might die from opioids. And, personally, I even was on opioids. I was on 12 different medications as a fibromyalgia patient. And I don't use anything except for cannabis and other plant medicines now. So I know it can do so much for people. And it's been so frustrating to see all these things happen. But, that passion that I've had for fighting the injustices that we see, has really helped me be able to advocate all over the country, all over the world for patients, change laws, and really just fight, even though at a family level, I don't have the support of my family. My family told me that they hope I die until I give up cannabis and stop shaming them, so I've lost a lot, but, in the end, I think it's so important that we remember that there's nothing worth we have to fight for what's right, and we can't let any of this other stuff, get in the way. So for me, knowing that there are patients that are going to have a better life because of the fights that we've had is so more important than, some of the other things, like my parents not really caring about what I do. So, it's been hard, but it's been great. And I'm really lucky to be alive due to cannabis, and also be able to help other people live a better life.
Really, I really appreciate you sharing that with us. I think it's important that part of this journey is removing the stigma, is more and more people sharing their personal stories around cannabis and just that journey. So I really appreciate that. Dr. William, can you talk a little bit about your journey into this space and what led you down this road?
Sure. For me, it was just being probably in the right place at the right times, having an open mind, and people being transparent like they are being today. And honestly, like everyone has mentioned, a long time ago, we've come really far, but we still have far to go. But my first introduction to cannabis was when I was 16, but it wasn't like how everyone else would think. But I was at one of my friend's houses, and we were doing a project together. And her mom had just mentioned cannabis. And back then I was a dork just like everyone else who wanted to be a doctor. And I was like, oh, had seen those Dare commercials. And I was like, no, cannabis, I need to conserve all my brain cells, like blah, 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 all the same rhetoric that everyone has heard. And I was just fortunate enough that my friend's mom took the time to educate me. At the time, she let me know that when I told her that I wanted to be a doctor, she told me one of the most important things is to really listen to patients and understand their experiences. She told me she was just like everyone else, a regular woman. This is when I was in high school, back a long time ago. And she had lived her life fully. She just went on a trip to Mexico, started developing seizures. At the time, none of the medications were working. I'm from Canada. So in Canada at the time, cannabis did have some exception rules for medical patients, but there was no way for it to be really grown before like 2000s. So at the time, though she was just a suburban mom, she was worried. She was upset because the doctors didn't believe her. Anyone who saw her as malingering. And she actually was being followed by the cops. And just like all the speakers have mentioned, if you are not in an open environment, that can really just take a toll on a person, especially when they're a patient. So I always kept that with me. A couple of years later, when I was in pre-med, I was assigned an assignment to discuss a radical topic in medicine that maybe, we wouldn't discuss in the curriculum. When I started looking at the data, I was shocked to see that there was not a lot of research on it. And I contacted my friend to see, she could let me know. At that time in Canada, her mom and her had started doing a lot of advocacy work. She was only 18 at the time, but she was speaking. And her mom later went on to actually bring a court case against the Canadian government to prove that they were kind of in a gray area, much as we are today. There are certain laws where, yes, certain people were given a medical card, but they couldn't grow it and there was nowhere to access cannabis. So if they had it, they were criminalized. So I did a presentation on that. And as I continued to do my clinicals, I noticed that most of the patients told me that they were using cannabis when I asked them to cope with stress, to deal with some of their symptoms. The ones that were open back then, many people didn't discuss it. And then later on, I saw that my friend and her mom's advocacy work actually helped change laws in Canada. And it made me realize it takes people being transparent, being real about their stories, and it's the little people that change things, like you and me, having this conversation. So I've just been more open-minded about it. And I was in Illinois doing my residency. At the time, medical cannabis became legal. So my patients started being more open. I would say 25% of my patients were telling me they were using cannabis in addition to the medications. At the time, the University of Illinois obviously wasn't letting residents prescribe or any physicians prescribe. But, other physicians were prescribing, and we were also seeing those patients. Later on, as I moved to Michigan, where I started working at my first practice, medical cannabis was also legal there. So my patients were open and transparent about it. And about 2 years ago, medical cannabis really took off in Michigan. 4 years ago, I've been living here for a while now, sorry, 4 years ago. And as it got closer to the time that they decided to legalize cannabis in Michigan, I would say almost 50% of my patients were telling me that they were using cannabis. And I personally got into a car accident. I went to Colorado for a snowboarding trip. I got a CBD massage, and literally I had gotten like 3-4 massages that week. Nothing was working. I felt better within 20 minutes. When I went back to Michigan, we just started having a little bottle of like hemp full spectrum, because you can't have CBD. in my office, and I just kind of put it on my patients. And somebody I would have to give benzodiazepines or muscle relaxers to literally could walk out of my office moving their neck and just feeling a little bit better. Being realistic, obviously, that it's going to not cure anything, but being realistic about expectations is important. But as I saw that how effective it was, I started telling more of my patients about it. And musculoskeletal complaints are the #1 reasons people see primary care doctors. You know, back pain is one of the most common complaints. And if it's related to muscle pain, most of my patients are able to take less medication. I'm a plant-based physician. When I stopped eating meat, not voluntarily, really, my body just started rejecting it. I have a lot of illnesses myself. So that's why I say my own experiences with cannabis also help. I realized that hemp is one of the plant-based products that affords you protein, lots of nutrients. And when we used to study medicine, like 10, 15 years ago, they used to say, you know, besides animal sources, there is no way to get all your essential amino acids and things like that. And when hemp seeds started becoming more popular, there is your essential acids and a bunch of benefits. And that's a pretty legal way. You're not smoking it. I have patients that have to take multiple supplements for whatever reason. They have a lot of medical conditions, and one of my patients who had to take like 9 to 10 tablets of magnesium, and she didn't want to consume that much, started taking like hemp seeds and magnesium from chia seeds. And honestly, her levels are better, because when we take minerals from natural sources, it's better absorbed than supplements. So just seeing the different benefits of hemp and how you can just naturally incorporate it into medicine, it just makes sense to me. But one of the things that I noticed, as many of the people already have mentioned, is that a lot of the environments where we work, a lot of policies that were being passed didn't really align with evidence, and there was no support for it. A lot of companies say you can't prescribe cannabis. In Michigan, we started getting new laws about opioids, and patients that use cannabis can't be prescribed opioids, but there wasn't even data then to support that. And it didn't make sense to me. When I questioned it, I got a lot of pushback. So I was like, okay, I'm going to move. I moved to Florida, and I was going to start my own practice. One of the things about Florida is, since we are at the medical cannabis stage, it's kind of like going back a little bit, 10 years. When we talk to patients, they're very fearful unless they have a cannabis card to tell us that they use cannabis. But when I tell them, hey, I'm from Canada, don't worry about it, they kind of relax. I'm like, it's legal there. And they're like, oh, okay. They even like start thanking me. So I think that it's really important in the primary care setting to normalize using cannabis or any substance, because people should feel comfortable telling their primary care doctor, hey, this is what I'm doing. Because as a doctor, with smoking anything, we know telling people to quit cold turkey, that just doesn't work. There's tons of data. We help them reduce harm. We use other substances, and we kind of know that being open and honest and transparent with our patients is the best way to be, and we need to be doing that with cannabis.
Perfect. Thank you. Thank you, Dr. William. Dr. Weiner, please tell us about your journey into this space.
So similar, to Dr. William, I'm in South Florida, which is basically the highest opioids in the country, right? So Broward County, as a pain doctor, Broward County definitely was hit the hardest with that. And so we have a huge opioid problem here. So as a pain physician, once cannabis became legal, I ended up, trying to learn as much as I could, trying to put my chronic pain patients who were taking opioids, which really only work for acute pain, on cannabis. At the time, it took 3 months to get your medical card. So you had to actually know the patient for 3 months before they were allowed to use cannabis in Florida, which was crazy. So I started incorporating into my practice, and I saw this huge substitution effect that a lot of people were getting off their opioids, their benzos, their sleep medications, I personally had an experience with my grandma where she had a very negative side effect from tramadol. And because of that, that kind of is my other passion, which is the senior population. And so I started speaking at a lot of these independent living facilities and, you know, kind of like blew their mind, because to try to get them to understand the endocannabinoid system, and then to try to get them to use cannabis and do it in a safe way and get their family, you know, to be supportive was a big challenge. But I figured if I could get them on board, then, you know, and especially in Florida, then a lot of people would follow. And the interesting thing is the seniors were really into it because obviously they have a lot of, you know, dysregulation, but also they had tried and failed everything. So they were in chronic pain or not sleeping or on a lot of medications with so many side effects and then on another medication. So the seniors were a little bit more open to it. And when I would tell them about, you know, there's no toxicity and you can't stop breathing from using this natural plant. So I started getting more and more, probably 2/3 of my practice is, you know, over 65. And then obviously I did some research showing that almost 40% of our patients weaned off opioids completely, and then had, you know, a lot of other substitutions in terms of other pharmaceuticals. So for me, I didn't have a lot of opposition because I would present to other physicians, well, here are our current options, here are the current tools. People are using opioids for chronic pain when they shouldn't and becoming addicted to them, obviously. And so here's the evidence that we've seen. And so people were willing to send me patients to help them. And my frustration was really when the pain doctor would kick a patient out of their practice because they were positive for THC and they were on opioids. And that was my big frustration. So I kind of was, I get patients from the pain doctors, even though I'm a pain doctor, because they kick them out. And so I wanted to have people understand you can't get off something unless you start something else, right? So it's, you know, that's what we talk about, harm reduction. So I had no problem, you know, showing them how to do that and then educating a lot of the physicians in Florida. And, you know, over time, even though I was an interventional pain doctor, I'm part of a big practice. And I just stopped doing a lot of the spine procedures and got more and more into cannabis because I realized it was just it was one medication that has so many targets. And so when they came in for one symptom, but then we would discuss how are you sleeping and how's your mood, and then how's your sex life. And then the next thing you know, the patients open up and they tell us things because they're willing to tell us about their cannabis use or, you know, the other things that they're using. And then I started developing relationships with my patients that I realized when the patient was head down, you know, on the table to do an injection, I wasn't getting much of that relationship. So for me, my life became much more enjoyable. Going to work was really, you know, very satisfying for me because I developed these relationships. I saw the patients improve. And a lot of times we don't see that. We see the frustration with Western medicine. So now really I like to tell the patient to listen to their body, you know, and to empower them to say, this is your health. This is not my health. We can actually, you know, work together. You can have a relationship with the plant, you can have a relationship with yourself, but you have to pay attention to their, you know, internal terrain, their internal physiology, so that they know what medication to use, what ratio, what route of administration, and then personalize it. And I think that's very empowering for the patient, that they're able to take control of their health and then cultivate health, you know. So for me, it's been quite a journey. Now I'm a little bit more into, you know, I've opened up to ketamine assisted psychotherapy, which I think is amazing also, because really pain is in our consciousness and we just need ways of dealing with this and new perspectives. And a lot of the patients, you know, who are just kind of stuck within minutes of smoking marijuana, they can kind of open up and have a new perspective on things. And there's not many other things we can do that with that are as safe. So it's really been, you know, quite a journey, but I think that it's a great time. I was also at the right time, right place type of thing. And now we're focusing on healing and preventing disease and, you know, promoting health as opposed to trying to fix what's already been done, right? So it's a new perspective that physicians are, I think physicians are frustrated with medicine too. They're frustrated with their limitations. And so they hear patients, you know, using this. Sometimes they don't want to incorporate in their practice, but I think they're a little bit more open-minded because of the you know, our Western medicine model is failing us, and especially after the pandemic, we're going to have the second pandemic of mental health issues, and, you know, transformative medicine and psychedelics and cannabis is really that catalyst to make some change. And then we just need the evidence where, you know, there, or how you're talking about that, you know, descheduling would be amazing. So that's my journey.
Great, great. I appreciate that. So as we talk about these things, sort of from a medical professional perspective, and also how this impacts the patient, right? And one of the things I want to ask you, Dr. Knox, is 2020 COVID, incredible change. How can we reimagine this relationship vis-a-vis the patient and their doctor? Something has to give. Can you give us your thoughts there?
Yeah, something does have to give, and it's not in the clinic or in the hospital room where the patient and the provider exist together. I really think it's time for us to understand that the medical system is not the healthcare system. They're not the same thing. We use them interchangeably, really to our own detriment, because it prevents us from truly understanding what important roles a lot of other sectors in our society need to do to step up to the plate to help us facilitate health equity, which is my passion these days, right? Especially with respect to cannabis and the economy of cannabis, and literally the innovations of this plant that can be used to clean up our ecosystems. COVID-19's disproportionate impact on Black and Indigenous, and as well as Latinx communities, is not because people of color are genetically sicker, right? It's because of decades of systemic racism and disinvestment in these communities, the ecosystems within which people reside, that has resulted in this minority health disparity gap, right? We have to think about the ecology of things in terms of human equity, environmental equity, economic equity, and social equity, right? We have to think about healing our communities through those four pillars, right? And those four pillars, when you add them together, are total equity, or what I call health equity. We have to recognize that, right? Our food systems are terrible in this country. Access to clean air, clean soil, clean water, huge issue, right? Access to services, huge issue. And if those sectors that are in control of those arenas in our ecosystem don't recognize they're part of the healthcare system, then we're never going to heal. We aren't. We can turn to natural solutions. We can advise patients to turn to natural solutions. If we send them back home into ecosystems that do not facilitate health, they're not going to get healthier. They won't. Sure, we might be able to swap out pharmaceutical drugs for cannabis preparations or psychedelics. That's great. We could improve quality of life, but if we really want transformational healing, we have to hold to account those other systems, right? I'm talking about big food. I'm talking about big ag. I'm talking about our Department of Justice. I'm talking about our medical system. I'm talking about our governments. We need radical alignment of these agencies and understanding, again, the role that they have to play along with us medical professionals in truly healing our society. You know, if we were healthy people, we could have withstood the assault of SARS-CoV-2. We couldn't because we were already sick. You know, so I think it's going to take a systems approach. It is. Again, we individually can absorb enough information to empower ourselves to change, right? We as patients, we as providers, we can do all that. But if society isn't changing as rapidly as we want to change, we are going to run up against barriers that we can't mount and we can't surpass. So we all have a role to play. And I just hope medical professionals start to take these sorts of conversations to our Capitol Hills. We have to recognize that if our medical boards aren't going to change, we can direct legislation to direct our medical boards to change, right? So we have to exercise, you know, our political will too, to the tune of social reform, so that we actually can have a productive environment through which to counsel patients to real health.
Thank you, thank you. Dr. Lynn, so I would like to get your perspective. Dr. Knox was speaking of a systematic change that is required. Overall health system on a very macro level. what can we do tomorrow to impact the patient-doctor relationship where people can start feeling more comfortable telling their doctor exactly what they're doing, especially in this cannabis space? People still have some serious issues about talking with their doctor and back and forth.
Great question. What can we do tomorrow or immediately now to improve the doctor-patient relationship? Honestly, it starts with the physician. I set the tone for what the relationship will be with the patient. If it's hostile, if it's negative, it's because that is the tone that I set, right? When you come to me asking for help and looking for help, my voice, my pronunciation, my actions, my way I hold your hand, the way I greet you, all of that has to be warm and inviting immediately from when you walk into the room. So if you don't have my trust, if I don't have your alliance, if you don't feel a connection with me as your provider, that you can be honest and open with me, we're never going to break down those walls. We're never going to get past that. So it's important for me to take each patient as they come. How I interact with a 19-year-old Black male is completely different how I interact with a 65, 70-year-old white female, right? It takes two different type of interactions. And that's just true because you have to approach the patient as the patient is. You cannot be monotone in your approach. This is an art when you create a relationship. It's just like dating. You have to take each boyfriend or girlfriend as they come and work within those parameters. So it's important for me to make sure that anytime I interact with a patient, that for myself, I'm presenting my whole self and I'm being honest with the patient. I'm not gonna have the patient tell me their deepest, darkest secrets without me sharing with them, right? So if my patient comes in and they're like, I kind of smoke every now and then. I'm like, so what do you smoke? What do you like? You use edibles? Like, what else is going on? How often? Do you only do it at night? I'm able to gauge more information when you come to a patient, being more informed about how you're going to talk to them rather than saying, you smoke for real? Why? Like, it's important that you're non-judgmental in your approach to patients. And that way they can feel the warmth, they can feel the love, you can share your stories and they can relate to you. Because if they can't relate to you, they're not going to ever give you what you need in order to make that the best possible interaction and get them the best health and wealth, you know? So it's really important for me as a physician to set the tone. And I do that differently with each patient. And it's just a matter of the vibe you get and the energy you get as soon as you walk in the room, and you create that with the patient. So it's our responsibility to create magical experiences and the best possible experience with each patient.
Right, absolutely. And kind of piggybacking on that, Dr. Ross, can you talk a little bit about that? I hear a lot from various people about the relationship. Relationships with doctors are not warm and fuzzy like you explained, Dr. Lynn. Typically, it's a very cold experience, at least in my personal journey. All the doctors I visited, probably I can count on 2 fingers friendly doctors. So can you talk a little bit, Dr. Ross, about the importance of building that relationship with your patients and how that can actually affect the ultimate outcomes?
Yeah, absolutely. I mean, after talking to patients, they are still so scared, even getting a medical marijuana card, talking about their past cannabis use, right? They're afraid that maybe somehow during this conversation, somebody's going to know that they smoked without it and they're going to get in trouble, or they're going to lose their job, or there's some kind of, thing that they're so scared of. So really establishing that trust and that building that relationship and letting the walls down is so important. And because I'm a patient who really has had their life saved by cannabis, I really let them know that I'm a patient too. I understand how hard it is. I understand, having to get cannabis from the black market. Your past experience doesn't matter. What matters is that we're going to use cannabis properly to heal. And what I really love about cannabis is not only its, ability to heal, but also to help, again, transform and help us recover from trauma. And so a lot of the conversations I have about cannabis are also about how we use cannabis, not just to numb ourselves, to get us through, this horrible year, for example, where a lot of people have actually even lost family members and things like that, and suffering from real severe depression or substance abuse. How can we transform our pain properly? And using cannabis with yoga or using cannabis with meditation. These are conversations that I've had with patients, and they had no idea that you could do these things while high, and that these things would actually be better or more helpful for them in processing and releasing their trauma. And so I've had so many conversations with people where they had no idea that cannabis could be used more in than this very clinical pharmaceutical way, almost like, here you go, you have back pain, this is what we would suggest you use. There's other ways to use cannabis. And also, the other thing too is acknowledging that many medical patients also use cannabis recreationally, and I support that. If that is going to be a way that they're not going to be abusing alcohol or other drugs, and they're using it for stress release, that's okay. And I support recreational cannabis use in recreational markets throughout the country. But I think it's so important to acknowledge that some people feel very weird about using it medically, and also admitting that they like to use it just to, kill stress or relax. And that's okay, and that's normal. And making patients understand that, we affirm their use as long as it's not harmful to themselves is so important.
Thank you. And Dr. William, can you speak a little bit about this concept, this idea of how reimagining this patient-doctor relationship, sort of your thoughts there and what's possible?
Yes, I obviously agree with all of the awesome things that everyone has said. It was awesome. And I really think that what's important is that, like everyone here has said, that when they usually go to the doctor, it's not a great experience. And I think it has to do with people not understanding the real evidence. Most often I hear people just repeating rhetoric and research and data that is not good data. I think if COVID has taught society anything, it's that there's good data and bad data, and you have to know what is what. So most of us know that in the US, due to restrictions and cannabis being a Schedule I drug, it's not easily accessible to be researched in a real world way. A lot of the data that we have is always looking at harm and not in a harm reduction way. And I've never heard people be so concerned about schizophrenia and psychosis as when it comes to cannabis. Usually no one cares about that. But as soon as we start talking about cannabis, everyone starts citing these things. And when I tell doctors, well, you seem so concerned, have you looked at the data that shows that, even patients from schizophrenia can benefit from cannabis, and it's able to alleviate some of the symptoms that we haven't been able to do with traditional medicines. So it's important for us to understand the data when we are talking to patients, so that we are telling them real things. Public education is important, and I think COVID has taught us that when you tell people unrealistic things, they stop believing you and they stop interacting with you. Back then we used to hear like smoking cannabis or using cannabis would like be as deadly as heroin. We obviously know that's not true now because of how prevalent cannabis use is, but it's important to understand the data that has been researched. Canada has already legalized, Mexico has. We're actually going to probably be behind. So when our patients come into our office, it's important for us to look to outside sources and educate ourselves so we can provide a safe environment, trauma-informed environment. Most often, the reason I hear that people are using cannabis is to cope with trauma, PTSD, and traditional resources don't work, like everyone has mentioned. And if this improves someone's quality of life and helps them live longer because they aren't going to do something that's detrimental to themselves, or is going to help them cope with a bad situation that they can't get out of, I think that there are certainly benefits from using cannabis. And furthermore, I just think one of the most important things is we need to fight policies in our own institutions on a federal level. Obviously that's happening, we talked about that, but it's important in the places we live where we work that we advocate for policies being evidence-based. One of the reasons so many of us have had to go independent routes is because the policies aren't making sense. So educating people, whether that's your patient, about the real data, like I spoke about the opioids and being just kind of not helpful. We're leaving pain patients with very little options, as everyone has mentioned. So that's about it. Those are my recommendations. That's it.
Speaking on that, we touched on the policy, and Dr. Knox, you touched on sort of the advocacy on with the medical professionals on the legal space and reform. The MORE Act just passed the House today. Can you give us your thoughts on that as we move forward and see if they're actually do a Senate vote or not?
Sure. Undeniably, this is a historic moment. But unfortunately, unfortunately, some amendments were added last minute that gave the MORE Act a regulatory framework at the federal level. What they did is create a federal permit that will be required of all cannabis operators in every state, in addition to state and city licenses to operate any kind of cannabis business. So kind of like the Marijuana Tax Act. We are seeing a play for the federal government to control the market at the federal level. Secondly, within this new provision, there is a felony clause. And it doesn't state that you could be denied a permit on the basis of having a cannabis conviction. It states that you could be denied a permit for having legal proceedings related to a felony violation. So overnight, almost, the MORE Act, which has been lauded as an equity bill, became wholly unequitable, especially when we understand that economic agency is a determinant of health, and that people of color who are disproportionately impacted by those felony violations will not have a fair inroad to participating within this multi-billion, if not multi-trillion global cannabis market. That was a loss. Unfortunately, I take a firm stand on this personally. I'm from Oregon. Congressman Blumenauer is my congressman. And this is really unfortunate, right? That our staunch reformers within the House, within Congress, did not catch this and did not cut it before making it to the floor today, I think was a loss, because it sets a very ugly precedent. One of the things it does immediately is cause alarm in investors and businesses who wanted to do the right thing when it came to social equity, maybe hiring people with, past convictions, or investing in companies owned by people who have these violations. So immediately, even if this does not pass through the Senate, those who are risk averse might not invest in businesses or invest in those hires, again, of people with felony violations. And unfortunately, that's disproportionately represented in people of color. So, the bill wasn't perfect to begin with, but we were okay with it. It stood to deschedule and decriminalize. It created an equity fund to pour resources into communities of color, but it kept the same, prohibitive barrier to entry into the industry that people of color are fighting for at the state level. This new provision actually undermines a lot of work that has lasted many years in states to create equitable frameworks, right? To create social equity programs that included benefiting those with prior convictions. So I'm not happy about this one. I wish I could celebrate the MORE Act today, but I can't.
Let me ask you something. When was these amendments added? You said recently?
A week ago.
Okay.
A week ago, and they weren't made available to us until Monday of this week. So a lot of the equity organizations within the industry, and I mean the leading organizations, think MCBA, M4MM, et cetera, felt very slighted by this, and we've rallied. I'm with MCBA. We rallied together in coalition to figure out what we're going to do. Like, how are we going to respond to this? Because that in and of itself was a deal breaker for us. It was a non-start. And we all hoped that the bill would have gotten pulled, but this is a political feat for the Democratic Party. So we understand why it was not. It was intended to be a messaging or a signaling bill, and it did signal something, right? It signaled that the majority of us want to deschedule and decriminalize. And that's wonderful, but at what cost, right? That provision should have never made it through. It should have never made it through, because now we witness people settle for a very inequitable provision just to deschedule cannabis as for adult use. And in general, I mean, it's not good enough for me. It's not. And the other thing, the last thing I'll say that the MORE Act never touched upon was cannabis as medicine, right? We've talked about, use of cannabis amongst this group, right? Access to cannabis as medicine. People of color are least likely to use cannabis as medicine for the criminalization, over policing in our communities. Right? When we talk about community restoration, we need to talk also about making sure cannabis is accessible to those communities as medicine. That it was not, not included in the MORE Act is not unique to the MORE Act. And that's the other reason why we medical professionals need to be in our legislators' ear, right? We lack severely cannabis competency within the medical system, yes, but also within legislation. We lack it within the regulatory bodies that do govern cannabis in legal states. We lack cannabis competency, and unfortunately what that does is result in a highly restrictive, fear-based regulatory framework. And I do think that is an existential threat to the viability of the medical industry for patients. And so we need to be involved. They need to hear us talking about cannabis as medicine. They need to hear us talking about health equity. I'm a board member of Doctors for Cannabis Regulation, and the majority of our board is actually women of color. So we are charging this organization to start taking a real stand around cannabis health equity, right? We talk about the criminalization and the war on drugs being a public health issue. It is now time for us to start talking about cannabis as a root solution to driving health equity.
So, notwithstanding sort of these additional amendments that Dr. Knox so eloquently detailed, you are a researcher, Dr. Weiner. Can you talk a little bit about just the significance of if cannabis was descheduled?
Sure. So the biggest issue we have is that since it's a Schedule I, the University of Mississippi provides the cannabis to do research, which is not really what patients are using in the dispensary. So you need a specific license to do research. And second of all, the actual cannabis had mold on it, right? So that's just one example, of how this is how everybody is failing us, how we have to get much more involved, and they have this monopoly over the cannabis that can be studied. And that's the biggest issue. Like Sue Cicely has done her research with PTSD and veterans, and really been such a huge advocate speaking up about the fact that it's 4% THC with mold on it, right? So the problem is we're doing research in the United States on cannabis that is not equal to what the patients are actually getting in, medical dispensaries, let's say. So that's one thing that obviously has to change. Even if it's not going to be descheduled, which we all hope it will be, there should be more places that are providing cannabis that are actually equivalent to what patients want to, need to use and want to use, so that when we do have good evidence, it'll be reflective of what's actually going to be available to them. And, that's the big problem, is always consistency in medication, access to medication. But, how can we say that a study, if a study is not effective, it's like it's setting us up for failure, because the cannabis that we're able to study is not even, effective or not even safe, right? So obviously the whole point of a medical program is to have safe, lab tested cannabis, right? That exactly what you're getting. That's the benefit of having it in your state. So, there's a lot of challenges. First, you need the Schedule I license, and second of all, they have this monopoly, and it's not even consistent with what patients have. So that's a big challenge, but we just need a little hope. We need a little hope for the future, because everybody, especially with the pandemic and all these other issues, we need to have some form of hope for our future, which all of us women, it's wonderful, working towards this, advocating, speaking up, and this has been great. I love hearing everything that you guys have to say.
Great. Thank you.
If I could say one more thing about that. One, we have hope with what the UN did, right? They voted to deschedule cannabis as medicine, right? With the emphasis on as medicine. But two, even if we don't deschedule through MORE Act, right, it has to pass through the Senate, and we're actually not confident that it will, is to get creative, right? Hemp is legal, and hemp competency is cannabis competency. And what I would like to see states do is start researching hemp, not the industrial hemp, but start researching the chemical profile, start researching full spectrum. That is a good surrogate at this time for marijuana. You can extract THC in a state like Oregon, right, where marijuana is legal. There really is no risk to having hot hemp. If we could get our legislature to understand that we could route that hot hemp into our research centers to start studying higher potency THC products. And not only that, the products that are grown in Oregon. And I think all states need to understand that. You should be studying and researching your homegrown cultivars, because that's what your patients and adults are using.
Great. So this whole season for us has been dedicated to Free the Plant. And this topic to end our season was Free the Patient. And so obviously we have the doctor speaking and talked about the patient-doctor relationship. If I can ask you, Dr. Lynn, what ultimately does free the patient mean to you?
Free the patient means to me that each patient has access to medicinal marijuana if they choose to use it. Regardless of cost, regardless of diagnosis, if that is your choice and that is what you choose to medicate yourself with, then you should have access to the plant. And the biggest issue in Florida for us is cost. It's $75 to get the card. Most patient visits with physicians are anywhere from $150 to $300 per visit. The product itself, you can't go into the dispensary on a first-time visit and spend less than $125. So you're already out the gate $500 before you even start, and to even know if something works for you. And a lot of this takes time, patience, dedication, and creativity. So what works for the next man might not work for you. So you have to be committed to trying alternative routes, trying different dosing, trying different ways to prescribe and times of day that you use. It's all an art to how you prescribe for patients. So freeing the patient allows them the option to choose medical cannabis as their first choice for medication rather than their last, and also gives them access to the product without all these other barriers of cost and distance to the dispensary and access to a doctor and all of those questions that patients are fearful of. Making sure that they have complete access is important.
Absolutely. Dr. Knox, I want to piggyback on what Dr. Lynn just said there. So as we talk about free the patient, and you express sort of this cannabis is medicine, why that phrase is so important. Will that also get us to maybe health insurance covering these costs of cannabis for the patient? Is that part of it?
I don't know if we can be too certain that insurance is going to line up to cover the cost of what you can get in a dispensary, right? If I'm reading the writing on the wall and understand that there are big biopharma, not just big pharma, but biopharma, and also other big companies, think Walgreens, think Walmart, think I don't know, name any big conglomerate involved in, the wellness space, right? We're going to be competing with those interests, and they have the money, they have the lobbying power, they have the connections to get their products insured, right? And I think we need to understand that. I am confident there are going to be alternatives. We have, micro health insurance systems popping up state to state to help cover the cost of cannabis as medicine. But I'm not going to hang my hat on our conventional insurers covering cannabis just yet. There's so many variables. We celebrate the genetic diversity of cannabis. That's not the lane that big pharma operates in, right? They're into monomolecules. Epidiolex is nearly an isolate, in and of itself.
Yeah.
So I think it's going to be a while before we see health insurance cover the whole plant, right? The full spectrum products that are on dispensary shelves. I could be wrong, but I want to agree that freeing the patient has everything to do with access and agency. I think we doctors have to get out of their way. We doctors need to help get the medical system out of their way. And it's not just about cannabis. We've mentioned psychedelics here. I'm really excited that Oregon legalized psychedelic assisted therapy, and we're going to have the same issues, access and agency. And that's the beginning and the end of it. And, I think we have to be very careful in stewarding these regulatory frameworks so they don't become burdensome. Think about the tax structure that states and even the federal government through MORE Act have contemplated. All that these onerous tax structures do is increase the cost of cannabis for the end consumer, both patients and adults alike. And so I think we need to be, again, at the front lines talking about ensuring that cannabis is accessible and affordable to all people. Again, that's another health equity issue. And I think this is an arena where it is our job as medical professionals to steward cannabis in the right direction.
I wanted to add to that.
Yeah, Doctor, I was definitely going to come to you because as a patient, right, and as a doctor, what does free the patient mean to you?
Well, I think that one thing that we really haven't touched on in this panel is the right to grow your own plants. And cannabis, yes, you can get it from the dispensary, but when we're talking about it not being covered by insurance, being very expensive, being overtaxed in some markets, and also having heavy restrictions over what patients can buy or not buy. For example, some states don't allow edibles, even though they are a form of medical cannabis. Patients don't have access, say, to the specific strains that they need or consistently have access to those same strains. There are some patients that need to have the same products delivered at the same quality month after month, and they don't get that in many markets, including those on the East Coast. The West Coast is a little bit different. It's much more of a mature market with a lot less restrictions, but I see patients all over the United States that are struggling, that are looking for the products that they need. Before COVID happened, some of them even traveled to recreational states to get the products that they needed. And they can't do that right now because of, the current situation. And I just think that if patients have the ability to grow the plants with the right terpene and cannabinoid profiles that they need, they were able to make that cannabis and turn it into, say, cannabis suppositories for pelvic pain or into edibles for sleep or whatever that they needed, they would have the freedom to really heal themselves. And right now, I'm even living in a state that I was actually shocked when I moved to Nevada. I can't grow my own plants. And I'm also one of those patients that needs specific strains that I can't find here, specific products. I have, as a patient and as a clinician, have actually had to drive to California to buy products that work for me and, break federal laws, driving across states, with these products. And I feel like that's just ridiculous. And that's not something we should have to ask patients to do. And so I don't think that I'm a free patient here in Nevada. I'm not. The system here is over-regulated, overtaxed, and we don't have the freedom to grow. And I feel like patients aren't free when they can't get on an airplane without fear of, traveling with their medicine and getting caught, or driving and having to tell a cop why there's cannabis in your purse. There's so many different issues that patients have to deal with, stigma from doctors. I even ended up in a psychiatric hold because I had cannabis in my purse when I went for severe pain. Like, this was years ago in California. Like, there are so many issues that a patient still has to deal with where they don't feel like they have the same rights as non, as patients that aren't using cannabis. So we have to create a system where medical marijuana patients are not considered third-class citizens, that we can travel, that we have the same rights, that we can own guns, all these things. We're not free. I'm sorry. We're living in this very messed up system that is very broken, that has so many systemic problems with it, but cannabis patients are not free yet. So please, we need to free the patients. We need to break all these bad policies. We need to change things at the federal level. But again, when we write bad laws, they're really hard to unwrite. They're really hard to change. Like in Nevada, I was talking to people and they're like, it sort of is like this. So, I'm not sure we'll ever get the right to grow here. And that seems silly. So at the federal level, we have to protect the right to grow when we do legalize. And I don't see that popping up in any of these laws that are written. I'm pretty sure the MORE Act did not provide any protections for that. In fact, I'm sure that they will try to very much take away the right to grow. Because of all the different interests that they're involved with that. So I think that we're not free, and we're going to have to fight every single day to make sure that patients are free.
Thank you. Thank you. And Dr. Weiner, the similar question, free the patient, what does that mean to you?
So first of all, I love what Dr. Ross said. I mean, the whole no gun, if you have a medical marijuana card, is absurd. And, we have that here in Florida. And then to me, and also about writing bad laws. We don't even have chronic non-malignant pain as a standalone diagnosis. And that's the number one reason in Florida why we have to put the patient under multiple sclerosis, because it's we have a similar symptom, so it's crazy looking at our information, how many people have MS in Florida. It's ridiculous, So I agree with you. To me, it means empower the patient to really take their health into their own hands. This system that we've adapted to is now just a reflex of us writing prescriptions and, doing whatever is FDA approved and indicated for that condition. But to me, it's a patient-centered model where the patient should understand and listen to their body and also be able to, to feel empowered. And it's like they say, start low, go slow, and don't be scared to go all the way. I think it's also important after a while to let the patient know it's okay to experience that adverse effect that they call intoxication or being high, right? It's okay for you in the evening to connect with yourself, to be able to be in the present moment and get them less fearful of that and not have that be an adverse effect of cannabis. So really about empowering the patient so that we can have patients be advocates as well.
Absolutely, absolutely. And Dr. William, please, free the patient. What does this mean to you?
Everyone has spoken about, honestly, the most important things: equity, access, and reducing stigma and making sure people are not criminalized in their homes, in healthcare, and honestly, just living a full, free, fulfilled life. I think a big part of free the patient is free the plant and free the doctor. And I'll elaborate. What I mean by that is free the doctor in the sense that the federal laws honestly prohibit so many physicians from being honest and being willing to prescribe cannabis. So many doctors are signed up in Florida, but only a quarter actually prescribe. So people are open to it. They just don't want another opioid raid situation where the DEA, comes in, knocks on everyone's door and closes down their clinic. That's honestly what I hear a lot from doctors. Another thing is doctors are also patients. As many of the doctors on this panel and myself have mentioned, we have tons of diseases. One of the things that people don't talk about is the suicide rate. Alcohol and drug abuse rate is highest among doctors. I've lost colleagues to opioid overdose. So at this time, people aren't even comfortable disclosing that they have depression or anxiety, and doctors can't get treatment, and we're losing people who are professionals who've dedicated their lives to trying to help people. They can't help their patients. They're distraught from it. It's like a vicious cycle. And lastly, I think we can't free the patient or the doctor or anyone unless we free the plant. There's like this war on THC. And honestly, it's only like one of the chemicals that's been isolated, so we know which one to say like is bad. And as other doctors have mentioned, there are definitely benefits from relaxing, being open-minded, maybe being able to seek spiritual transcendence, whatever the reason people decide to smoke, that's their choice. Having agency, access, all of those things are important. And I think that we can honestly change the world, just like everyone said here, when we change our relationship with this plant. Hemp and cannabis are the exact same thing. It's an arbitrary number that was decided that defines the difference between it. And I think the more we realize it and talk about it in an open and honest way, we can all live free.
Great, great. Thank you, thank you. You know, I'm just listening to this entire discussion, this panel. I really appreciate what you guys doing, because sharing the information, hearing it from your perspective, I don't ever underestimate how important that is to the consumer, the patient, to actually hear from doctors and medical professionals, to actually speak and share their personal stories. It's very powerful. So I really thank all of you for joining us. Thank you. Once again, LEAFSTYLE, no longer a subculture, it's a LEAFSTYLE. Thank you guys. Like I said, we focus on education. We appreciate you guys coming to share your information. And thank you. Have a great Friday.
Thank you. Great
for
job.
Thank you,
having us.
everyone.
Good
Awesome
seeing you
job.
all.
All right, have a good weekend.